So in our model, right, students are screened, they go to the provider, they get the brief intervention. A lot of kids are interested in having some further exploration of their current use and potentially creating goals for reduction. So what we've done in looking at our available resources is engaged our health educators as people to help provide the Teen Intervene portion of treatment. Teen Intervene, as we'll go through, do you want to give an overview of Teen Intervene to give it context?
Yeah, it's just a brief intervention. It's 2 to 3 sessions with a kid, evidence-based, and it's just a nice way to have a conversation with kids. And really the goal is to create personalized goals that the kid finds important. And so that can be done with a mental health provider, behavioral health provider, or the health educator is also a really great resource for that as well, particularly at our sites where we have really limited behavioral health providers. Health educators are there every day and able to meet the need a little more quickly than necessarily a behavioral health person would. So really both can be utilized for that.
And that's not something that we originally saw at the outset, and I think it's a really good nugget to kind of tuck away in your back pocket should you decide to implement kind of an SBIRT process at your health clinic, right? Yeah. Is looking at all available resources for implementation of this kind of program.
Yeah, because when Shannon and I were trained, we were trained as part of a national pilot, and they just had it for behavioral health providers and nurse practitioners. But we saw in our sites that really health educators are a huge asset that we should tap into as well.
Mm-hmm. So how do we screen the kids? The CRAFT screen is an evidence-based screening tool for adolescents. CRAFT stands for CAR, Relax, Alone, Friends, Family, or Trouble. It's a questionnaire that the students fill out when they come in for their appointment, right? They're sitting in the waiting room, waiting for their medical visit, waiting to get vitalized. It's part of their slew of paperwork that they're going to be looking at and filling out prior to the visit. And it's the only evidence-based adolescent alcohol and other drug use screening tool available now. There's a sensitivity of about 76% for any problem, right? It's looking at use, abuse, or dependence. And there's a specificity of 94%, so you might get like a 6% false positive. If you take a look at the tool, you'll see that there's a Part A and a Part B, right? Part A and Part B. Part A is looking at, have you ever, in the past 12 months, consumed any alcohol, marijuana, or anything else to get high? If any of those questions are yes, you have a couple different choices. The student can fill out the bottom portion on their own, which is really taking that deeper dive into risk factors for use, abuse, or dependence. You can have a conversation with the student around those kinds of questions, or that's about it, right? It can be either self-guided by the student or provider-guided by the provider. What we've done in our clinic actually is reformulated this a bit because it's kind of can get a little confusing if you're in 9th grade and sitting down to fill this out. We've just listed all the questions, and every kid fills out all the questions, and then the providers score it on the back accordingly, right? The way the CRAFT is set up is if yes, then fill out the bottom portion. If no, then don't fill out the bottom portion. And we found that kids got really confused. So we just said every kid fill out every question, and we'll take it from there. Okay. But what it's looking at as far as Part B, we're looking at the high-risk behaviors, right? Have you ever gotten a car driven by somebody who was high or altered? Have you ever used alcohol or drugs to relax or feel better about yourself? Do you ever use alone? Ever drink alone? Ever smoke alone? Have you ever forgotten things while under the influence of any type of substance? Anybody ever tell you that they were concerned about you? Ever have any friends or family that have expressed their concern for your use? Or have you ever gotten in trouble for it? Ever been caught at school, etc.? So these are really the higher risk behaviors, and what they show once we go through this CRAFT scoring, thank you, what it shows is that there is a probability of abuse or dependence. The higher the CRAFT score, the higher the probability of use or dependence. So if you score a 3, so what is a score of 3? That means of this bottom portion, you're having 3 of these types of behaviors, right? You're either smoking or drinking alone, you're forgetting, you have people who are expressing concern for your use. And that would be a score of 3. There's an over 60% probability the student has a abuse or dependence issue that requires some sort of conversation around it at least. The brief intervention really is focused on motivational interviewing, right? A motivational interviewing approach. And I'm going to just kind of share with you my approach to how I do it, right? So the patient's coming in, they're coming in for, let's just say, birth control, right? Attend to the chief complaint of the visit. And then I ask permission. I say, hey, you know, I thank them first. We're done, we're kind of closing up the visit. I thank them. I say, hey, you know what? I see that you filled out this craft screening, this questionnaire. Thank you so much for filling this out. Is it okay if we talk about this a bit right now? Right? So I usually ask permission first to talk about it. And then if they have a score of 0 or of 0, I usually give positive praise, right? You know, thanks so much for filling this out. I see that you're making some really good decisions right now in your life, and I want to let you know, like, that's going to absolutely, it's so silly, but I usually say, what do you want to be when you grow up, right? And then they say X, Y, Z, and I say, you know what, these decisions are absolutely going to help you get there, right? These are keeping you safe, they're keeping you, keeping your good focus on school, whatever it is, right? That's kind of the positive praise that I gave. It's a 1-minute intervention. Doesn't really interfere with my main chief complaint that I need to address during the visit. And it's kind of a done, closed deal. So then the question is, what happens when the score is higher, right? And that's the fun part, because you get to dig a little bit deeper, right? Depending on what it is that they're scoring high on. And I put it out and I look at it with the patient. If they've said, if I've ridden in a car with somebody who's been high or altered, I just say, so tell me a little bit more about this, right? Motivational interviewing, open-ended questions, exploring what the patient's experience is. They share their experience and we go from there. If they're having an even higher level of use, if they're saying, they're checking that they're using alone or that they're using to relax, I start with the same question, tell me a little bit more about this. I find a question that really gains trust is, what do you like about that? What do you like about smoking alone? What does that provide for you? What do you not like about it? What are your goals around it, right? What is it that, have you ever thought about reducing your use? How is it affecting you? When you put it out on the table, you say, let's talk about this, right? And let's talk about it in a genuine way. I'm not going to tell you what to do. This is what's happening right now. I see that you're making these decisions around your use. What is it that you want? When it really opens the door for kids to start talking about their stress, their family, all the juicy stuff, all the whole reason that they were there in schools with kids is to get them for those reasons. Yes, the birth control is important, but this is really, I think, the juice of care. What I found is that kids are really open to talking about it, right? Especially when they're using for stress relief or for coping, right? They are really open to talking about it and to engaging in change, just by the nature of the conversation. And sometimes that's in repeated one-on-one visits with the provider, and sometimes that's through the referral for an even deeper dive with the behavioral health provider or the health educator. That actually kind of brings us to the referral to treatment. So you provide the brief intervention, especially so if they're scoring 2 or higher, that's showing that they may have there's further assessment that's needed around their alcohol and other drug use, whether it's use, abuse, or dependence. And so that's not going to fully happen in your 15-minute medical visit when they were there for something else, right? This is really just the start of the conversation. And further assessment is needed. That's where the referral comes in. A referral either for the behavioral health or the health educator to complete teen intervene. But I think the important part about this referral and the take-home message that I want you guys to take from this is the kid needs to want it. So what does that look like? That looks like completing your brief intervention, thanking them for engaging in the conversation, identifying the goals that they have when they leave your office in that visit, and assessing whether they would be interested in talking about this further. Right?
And I think that's a key point, that they don't have to be like, yes, I want to stop using and I want to go talk to somebody about it, but just really, is this something you'd be willing to have another conversation about with someone? Would you be willing to explore this more? Yes, okay. Because most kids aren't coming into when they've got their referral like, so I really want to change it. It's not how this is happening. But they are willing to start that conversation. And really on the medical end, making sure that the kid is aware before the referral is made that the referral is being made is very important. Because, you know, it's the kids feeling that their confidentiality is really being respected obviously is really, really huge. And so in making referrals, making sure the kids are aware that that's happening.
Yeah, that is imperative because you totally lose trust otherwise if you make the referral and then somebody else calls them in and they have no idea why they're being called in. You can see how that might set the further intervention up for failure, really, because you have to go through so much rebuilding of trust with the student. So if you're scoring the craft score and you get a 2 to 4, that's where we're looking at assessing for an internal referral for behavioral health or health education for the teen intervention. If the student's scoring a 5 or more on the craft screen, I mean, that's basically having most all of these types of choices around alcohol and drug use. That potentially could mean that they need a higher level of intervention, like inpatient or outpatient, potentially. It requires further assessment, but we also need to be thinking like this might be something that's not handled internally. So this is the point where it would really kind of transfer from the medical perspective or medical part of the visit to the behavioral health part of the visit.
The one thing that we found to be really, really helpful is that before the kid leaves the office, the center, they schedule the appointment with the health educator or behavioral health provider. We weren't doing that at first. And as things happen, kids would take a while to get to them and things just aren't quite as poignant. And so just really having in your systems, in your workflow, it being set up so that before the kid leaves the office and the visit that they've had with the medical provider, they're setting up their appointment to come back and talk to whoever it is that they're going to be talking to.